Hello. Hello. Can you hear me?
Yes, ma'am.
Yes, ma'am.
There is network problem in college. That's why. Can you see the slide? Can you see the slide?
Screen is not shared, ma'am.
Not clear? Have you seen or not?
No, ma'am.
Ma'am.
No? Yes? No?
No, ma'am.
No, ma'am.
No? Bad network quality. Network is causing poor call quality. Network problem. Now, can you see? Hello?
No, ma'am.
No?
No, ma'am.
No, ma'am.
What is happening? Now, can you see?
Yes, ma'am.
Yes.
But
okay.
slide not on screen.
Slide not seen.
It's been loading, ma'am.
Yes, ma'am.
Very poor network in college. What to do?
Now we can see, ma'am.
Okay. What you have seen right now? Can you tell me?
Drugs.
No. Your voice is also not clear. So today we will be discussing the different drugs that act on the blood. So from today we will be starting hemopoietic system. Okay, I think it is already been covered in other department like in physiology, pathology. You have already studied various things related to blood, hemopoietic system. No, what is blood? What are the different constituent of blood? Okay, what are the different blood related disorder like the hemopathies? Okay, blood bleeding disorder. So these things I think you have already learned in pathology and physiology. Have you?
Yes, ma'am.
Okay, so do you know what is blood? What are the different constituents of blood? These are the very basic things you should know before drugs. Okay, before knowing the drugs, you should know what is blood, how it is circulated in the cardiovascular system, what are the different components that help the blood to flow in the liquid form, so that we can learn what are the coagulants, what are anticoagulants, in what condition we can give different drugs. You know? So what is blood? This is a very basic thing. Know what is blood?
With mesenchymal tissue.
Don't know. Mesenchymal tissues. That is, so blood is a very important. It is a highly specialized fluid or tissue that is circulated in our body. Yeah, in a closed vessels that is known as blood vessels. Okay, these are the highly specialized tissue that circulate throughout the body in a closed compartment that is known as blood vessels. Okay, so this blood contain various components like WBC, RBC, platelets, clotting factors, various enzymes, proteins. Okay, because these bloods provides various nutrition to the different tissues and the organs. So this blood contains various essential component that is required for our body. Okay, so these blood circulate in our body in the fluid form, not in the solid form. Okay, so they circulate in the normal physiological condition if the patient is healthy and the blood is circulating in the fluid form. Okay, so but whenever there is a prick or whenever there is an injury in the blood vessels, and this blood will flow from the vessels and it goes out of the blood vessels. Okay, during that process, what is the mechanism involved over there to stop the blood? You know, whenever there is an injury or any prick in your blood vessels and there is a bleeding, no? So when there is excessive bleeding, if there is no any mechanism to stop the blood, so our body will be deficient of the blood. There is a heavy loss of the blood from the blood vessels. So other components act, different components act over there to stop the bleeding. So that process is known as, what is that process known as to stop bleeding from the injured side?
Clotting.
Clotting.
Yes, clotting means formation of the clot. But the process of stopping the bleeding is known as hemostasis. You know?
Hemostasis.
Yeah, hemostasis. But there is a similar word, that is similar sounding word, that is a homeostasis. So you should know what is homeostasis, what is hemostasis. So don't be confused. What is homeostasis? It is a similar sounding word, no?
Maintenance of constant internal condition.
Yeah, internal environment of the body in the physiological state, that is known as homeostasis. But hemostasis means the stoppage of the bleeding from the site of the injury or from the site of the bleeding. That process is known as hemostasis. So this hemostasis involved various mechanisms. The first one is the vascular spasm. Whenever there is an injury to the blood vessels, our blood vessels will get constricted. That is known as vascular spasm. So when the blood vessels get constricted, the blood flow from the vessels decreased, minimized. Okay, reduce the blood loss for several minutes. That is one of the important first mechanism of the blood vessel. Okay, by causing vascular constriction. The next one is the formation of the platelet plug. So whenever there is an injury, the endothelium of the blood vessels get ruptured. So in the endothelium, various factors act like bone wildebrin factors that will act at the site of the injured blood vessels, and it will attract the platelet. Okay, that platelet that are circulating in the blood. So that platelet will go and bind at the site of, okay, that is known as platelet adhesion. So initially that platelet will go and bind to factors, okay, that like bone wildebrin factors that will activate at the site of the injury, and that platelet go and bind at that site, and there is a formation of there is a platelet adhesion. Okay, when the platelet gets adhered in that factors, again that will stimulate other platelet to go and bind at that respective site. So many platelets will come and bind at that injured site, and there is a formation of the platelet plug. You know, there is a many platelet that is collecting at the same site. Okay, that is known as the platelet plug. So initially this platelet plug is loose. Okay, because there is this platelet plug is not bind with any binding agent. So this platelet plug is known as primary platelet plug or primary hemostatic plug. Okay, so and after some times when the platelets get matured and there is a fibrin is formed from the blood. Okay, that fibrin, insoluble fibrin, will come and bind to the platelet side, and that will bind the platelets, and that forms the very strong bonding between the platelets. That is known as secondary platelet plug or secondary hemostatic plague, not hemostatic plug. Okay, in this way the bleeding from the site of the injury or the bleeding site is stopped due to the formation of the platelet plug. Initially primary platelet plug, and then after binding with the fibrin, then it forms the secondary platelet plug, which is very strong. Okay. And again there is another process occur that is known as blood coagulation. This blood coagulation, there is a formation of the clot at the site of the injury. So this whenever there are various different clotting factors in our blood, okay, from the factor 1 to factor 13. So that factor 12, that is go and when it touches that the injured side, okay, injured blood vessels or injured epithelium, that will get activated, that factor 12, and it initiates the cascade of reaction, okay, coagulating reaction. So and finally it forms the clot. Okay, that is it that it convert soluble fibrinogen into the fibrin. Okay, that is known as clot. That is the liquid blood is converted into the semi-solid or the gel form. That is known as blood clot, or conversion of the insoluble, and that is conversion of the soluble fibrinogen into the insoluble fibrin. That process is known as a coagulation. Okay, that things I think you have already discussed or you have already learned in the physiology very nicely. So I'm not going to spend a lot of time in this type of things. Okay, so this blood coagulation is the conversion of the fluid blood into the solid gel or the clot. So if this clotting takes early when there is a early clotting of the blood within the closed blood vessels, whenever there is not injury, not rupture the blood vessels, and sometimes there is a formation of the clot inside the blood vessels. Okay, that formation of the blood vessels in the intact blood vessels, that is known as thrombosis. Okay, but at the site of the injury, when it takes long time to clot, that is known as hemorrhage. It is a pathological condition. Okay, because of some deficient in the clotting factor due to any reasons, there may be chance of excessive bleeding because the clotting takes too long time. That is known as hemorrhage. The thrombus, which is formed at the intact blood vessels when it swept away in the blood from the site of formation. Okay, the thrombus is formed at some site of the blood vessels, and if it is taken away in the another site, okay, that same thrombus is known as embolus. Okay, when the clot formed at the site of the formation, that is known as thrombus, but when it is taken away in the another site, that is known as embolus. Okay, when there is a formation of that is known as thromboembolic condition. So this thromboembolic condition leads to various cardiovascular diseases like myocardial infarction, angina, because of the insufficient blood supply to the heart. So these are the very common terms you should know. Okay, what is thrombus, what is embolus, what is hemorrhage. So this is a very complex phenomena, okay, that requires a various cascade reaction. It is a complex cascade of enzymatic reaction that involves the activation of the various clotting factor, okay, in the fixed sequential manner till the formation of the insoluble fibrin clot. Okay, this is known as coagulation cascade. You know the different clotting factor? Do we know or not? How many
Yes,
clotting
ma'am.
factor are there in the blood?
12.
10?
Ma'am,
12.
12.
Yeah, 12, but the factors till 13 is there, but in between 6, factor 6 is not there. Okay, so total is 12, but the name factor up to factor 13 is there. No. So this coagulation cascade, okay, the process of coagulation follows two pathways. One is the extrinsic pathway, one is the intrinsic. Do you know what is the difference between this extrinsic and intrinsic pathway? Any idea? You know or you don't know?
Extrinsic pathway requires tissue factor.
Okay, good.
And intrinsic pathway is from the blood only.
Intrinsic factor, yeah, from the blood only the coagulation cascade is completed. Okay, clot is formed within the from the component within the blood. Okay, it does not require any factors, like it does not require the tissue factor or anything outside from the blood. Okay, that's why the name intrinsic pathway. Okay, extrinsic pathway means the initial reaction takes place only when there is a tissue factor. Tissue factor activates the clotting factor. Okay, that is known as extrinsic pathway. That means some extrinsic things, extra things is required for the coagulation from outside of the blood. Okay, that is known as extrinsic pathway. Whereas in intrinsic pathway, all the factors that is required for the coagulation is present within the blood itself. Okay, the only things is that the factor 12 has to touch this that is the damaged endothelium. Okay, and the factor, the initiation of the intrinsic pathway is from the factor 12. No, so before going to the intrinsic and extrinsic pathway, you should know what are the different clotting factor. I think you have already know this name. The factor 1 is fibrinogen, 2 prothrombin, thromboplastin, 4 is calcium, 5 is proacceleratin or labile factor, factor 7 is stable factor, and anti-hemophilic factor, and anti-hemophilic factor B, that is 9, stout factor 10. Okay, anti-hemophilic factor 11, C is 11, Eggman factor is 12, and fibrin stabilizing factor is factor 13. So you should have these things in tip of your tongue. Okay, this is very important. So these are some differences between extrinsic. So in extrinsic tissue factor, okay, that tissue factor that is released from the site of the injury. Okay, that will go and activate the factor 7. Okay, that is start with the tissue factor. But this intrinsic pathway, all the factors needed for the coagulation are present within the plasma or within the blood itself. So the name is given. Which factor is Eggman factor?
12.
2.
10 factor.
No, 10. 10 is stout factor.
12.
Eggman, yeah, Eggman factor is the 12. Okay, it is also known as contact factor also, because it will go in contact with the damaged endothelial cells. So when it stops the damaged endothelial cells, then this Eggman factor is activated. That means the factor 12 is converted into active factor 12, and the cascade of the reaction continues. Then it will again activate the other factors, and finally there is a formation of the insoluble fibrin from soluble fibrinogen. So because of the various factors involved in this process, it is a slow. But in when the tissue factor activate the factor 7, then it will activate factor 7 becomes activated. This factor 7 activates the inactive factor 10 into activated factor 10, and this factor 10 will go to the common pathway. Okay, that is, it activates the prothrombinase, and this thromboplastin, this thromboplastin along with the calcium that convert prothrombin into thrombin, and this thrombin is also known as activated factor 2. This thrombin converts insoluble, that is soluble fibrinogen into insoluble fibrin. Okay, so this insoluble fibrin becomes a clot because it is not soluble in the blood. Likewise, you can see in the intrinsic pathway. So the intrinsic pathway damage endothelial cells or the contact with the glass. Even when the blood contact with the glass surface, it will clots the blood. So if you withdraw the blood from your body and if you put in the sterile bottle, that blood will clot, that clot. Okay, because this factor 12 is activated even if it touches to the glass surface also. Okay. So this intrinsic pathway is started by the activation of the factor 12, where this extrinsic pathway is activated from the activation of factor 7. Okay, this intrinsic pathway factor 12 is activated. This factor 12 again activate the factor 11. Okay, this factor 11 again activate factor 9, and this factor 9 along with the calcium and phospholipid and factor 8, it converts inactive factor 10 into activated factor 10, and the common pathway that started. Okay, this is the common pathway, extrinsic and intrinsic pathway, and the final product is in fibrin. Okay, so this is the cascade of coagulation. This thrombin, activated thrombin, also activate this factor 13, that is the fibrin stabilizing factor. Okay, into the activated fibrin stabilizing factor, stabilized fibrin states is produced. So this is how coagulation takes place by the different cascade of reaction. Okay, of the reaction, coagulation factor and all like calcium, phospholipid. So any doubt in the difference between extrinsic, intrinsic pathway and what is common pathway? So that things I have already discussed. It is very slow reaction. Okay, intrinsic pathway, whereas this extrinsic pathway is pretty fast reaction. Okay, responsible for clotting when blood is kept in the glass tube, also responsible for coagulation after injury of the blood vessels. So to start the extrinsic pathway, always there should be damage to the endothelial cells, or there should be some injury. But intrinsic pathway is free. Okay, even if you keep the blood in the glass tube, the blood will clot. That is the intrinsic pathway. But for the extrinsic pathway, always there is a requirement of the tissue damage. Okay, until there is a tissue damage, unless and until there is a production or the production of tissue factor, there is no extrinsic pathway. So this is clear diagram of intrinsic pathway. Okay, contact with the damaged endothelial cells, then factor 12 into activated factor 12, 11 into activated factor 11, 9 into activated, and then 10 into activated 10 factor. So this is the formation of the activated factor. Convert prothrombin into thrombin, and this thrombin will convert soluble fibrinogen into insoluble fibrin. That is how the clot forms. So always there is a check and balance reaction between the fluid and the clot in the blood vessels. Okay, in the normal condition, in the physiological condition, we do not require any clot in the closed blood vessels. Okay, always the blood should flow in the fluid state. But whenever there is an injury or rupture of the blood vessels, the another mechanism should come into act. Okay, like the thrombin, fibrinogen, and various clotting factor come into. There should be active participation of all this clotting factor. Okay, whenever there is an injury. But in the normal physiological condition, we do not require clot in the closed vessels. So different factors or different other components that helps the blood to remain flow in the fluid state. Okay. So there are various natural anticoagulant mechanism which keeps the blood in the fluid state, which prevents the blood from the clotting in the physiological state. Okay. So if you have some injury at this in the blood vessels, and there is a formation of the clot at the site of the injury only. Okay, but if the clot becomes very big, it can hamper the other healthy cells also, all healthy endothelium cells also. If it goes to the other sides, then there may creation of the problems. So this thrombus formation or the clot formation should be limited to only the site of the injury. So different natural process will occur over there. Okay. So some of this is like fibrin absorb the thrombin into the clot and inactivate it. So if the clot is already formed, then this of the thrombin prevent the blood from the. This is one of the mechanism. Other is a prostacyclin. Think you know what is prostacyclin? From where it is produced? Prostacyclin.
Endothelial cell.
Yeah, it is produced by the endothelial cells from membrane phospholipid. Okay, from the arachidonic acid. If you remember NSAIDs class, prostacyclin, prostaglandins, these all things they are released from the, they are synthesized from arachidonic acid, from the membrane phospholipid. Okay, so this prostacyclin also they are synthesized from the arachidonic acid. So they are produced from the endothelial cells. They oppose the action of the thromboxane. Okay, this thromboxane helps in the platelet aggregation. So this prostacyclin, by inhibiting the action of the thromboxane, it inhibits platelet aggregation. So this prostacyclin is one of the 9 and 10. Okay, and also thrombin factor 2. So this antithrombin 3 is also very important component that helps in the natural anticoagulation process. So it also helps the blood from preventing the blood from clotting. Likewise, you have the protein C and plasma protein or the plasma protein which activate factor 5 and 8. So this protein C inactivate factor 5 and factor 8 and preventing the blood from clotting. Likewise, heparin sulfate, okay, it is a proteoglycan which is secreted by the endothelial cells which enhance the action of antithrombin. Okay, but it does not itself involve in the coagulation, but it indirectly involved in the anticoagulation by activating or by enhancing the action of antithrombin 3. Okay, these are the some natural anticoagulant factors, okay, which prevents the blood from coagulation. When the blood is in the closed compartment, we do not require any coagulation. Okay, so to keep the blood in constant fluid form, these are the components which are involved in this process. So they are known as the natural anticoagulant factors or natural anticoagulant mechanism. So now we come to the coagulants. So what are the different coagulant agents which is required in certain condition? Okay, in the normal condition, the person is healthy, and when there is no any deficiency of the factors, in that condition we do not require any the coagulant. We do not require any exogenous coagulant things. But when the patient having any deficient, like deficient in the various clotting factors, okay, deficient in the vitamin K, in that condition, whenever the person get injured or any hemorrhagic condition, excessive flow of the blood. So to control that bleeding, we have to give exogenous coagulant agents. Okay. So these coagulant agents are divided into two types. Either they can be given by the systemic route or that can be given by the local route. Okay. So the systemic coagulants are vitamin K, anti-hemophilic factor, desmopressin, adenochrome monosemicarbazole, ethamsilate. Okay, these are the systemic coagulants. Whereas we have some local hemostatic agents. That things we can apply directly to at the site of the bleeding. Okay. No need to be required of taking orally or intravenously or subcutaneously. Okay, these are only the local agents that can be applied topically only. So in this group we have aspirin, includes calcium alginate, hemocoagulase, and oxidized cellulose. Okay, these are some local hemostatic agents, also known as diuretics. So let's start one by one. Let's start with the vitamin K. So this vitamin K is a very essential factor that is required for the coagulation of required for the synthesis of various coagulation factor. Okay, some coagulation factor, they are totally dependent on. We know that vitamin K dependent coagulation factor. What are they? That require vitamin K for their activity. What are the clotting factor? They are vitamin K dependent. What are they? Do you know? Hello, can you hear me? Yes or no?
Protein S and protein C.
What are the vitamin K dependent clotting factor? All the factors, they are not dependent on vitamin K, but there are some clotting factor whose activation always required vitamin K. What are they? You don't know?
Ma'am, protothrombic.
Yeah, they are factor 2, 7, 9 and 10. Okay, these 4 clotting factors always require vitamin K for their activation. Okay, to initiate the cascade of the reaction, they should be activated. Okay, so for the activation, in this require the vitamin K. Okay, so this vitamin K is a fat soluble vitamin which is required for the synthesis of 4 clotting factor from the liver cells, second, 7, 9 and 10. So this vitamin K is essential for the synthesis of this 4 clotting factor, as well as this is required for the activation of this clotting factor. Okay, there are three different forms of the vitamin K: K1, K2 and K3. K1 is also known as phytonagione, that is, it is derived from the plant as well as animal source. It is a fat soluble vitamin. Is the K2 is menaquinone, that is produced by the intestinal flora. Okay, our body also K, that is stored in cells. It is also fat soluble vitamin. Okay, the third one is menadione. It is a synthetic form that is water soluble. So there are 3 different forms of the vitamin K. The first K1 and K3, The K1 and K2, they are the fat soluble, whereas K3 is water soluble. The K2 that is synthesized from our own body by the intestinal microbial flora, and chemically they are all naquinol derivatives. Okay, if you see the structure of the vitamin K, that is it contains the quinolone ring. So the sources of vitamin K is green leafy vegetables like spinach, cabbage, cauliflower, and tomatoes. Meat, milk, liver, and the pears all contains sufficient amount of the vitamin K pulses. In human, we can our body itself produce vitamin K from the colonic bacteria or microbial flora of the intestine. The daily requirement for an adult is 50 to 100 microgram per day. Okay, this is the daily requirement. But our body also synthesizes vitamin K. We don't know how much vitamin K is produced by the colonic. So if the colonic bacteria produce sufficient amount of the vitamin K, this amount is also not required from the exogenous source. Okay, so only 5 to 10 microgram per day is also sufficient. Okay, if our microbial flora produce sufficient amount of the vitamin K. So let's see the pharmacokinetics. The K1 and K2, they are absorbed from the intestine via the lymph and requires bile salt for their absorption, because this K1 and K2, they are the fat soluble vitamins, so they require the bile salts, okay, for their, whereas K3 is a water soluble, so it is directly absorbed into the portal blood without bile salt. Okay, it doesn't require bile salt for absorption. It is transported along with the low density lipoprotein, that is LDL, and it is stored mainly in the liver. So this vitamin K, they are stored in the liver. So whenever there is any liver disease, liver cirrhosis, okay, in that condition there is a deficiency of the vitamin K. So ultimately there is a deficiency of the clotting factor as well. Metabolized by the glucuronide and the sulfate conjugation, and these metabolites, they are excreted in the bile and urine. So these are the pharmacokinetics. Vitamin K, they act very fast. Okay, onset of action is very fast, whereas K3 has slow onset of action. So whenever there is an emergency condition, we have to give always vitamin K, because it acts very soon. Now let's come to the action of the vitamin K. How does it act in the clotting factor? Okay, it acts as a cofactor for the carboxylation of the glutamic acid residue of clotting factor. That means you have this clotting factors contain glutamic acid residue. So for activation of this clotting factor, this glutamic acid residue should be gamma carboxylated. Okay, until and unless this residue become gamma carboxylated, it doesn't. Okay, so this vitamin K, they act as an enzymatic. That means it cause gamma carboxylation of the glutamic acid residue of this clotting factor. Okay, so that the capacity of this clotting factor is increased to bind with the other component like calcium and phospholipid to initiate. Okay, you can see in the figure how this vitamin act in the clotting factor. Okay, these are the inactive precursors of clotting factor 2, 7, 9, and this vitamin K act as a cofactor. That means it causes the gamma carboxylation of this glutamic residue of this clotting factor. So when the glutamic acid become gamma carboxylated, they become mature active form. So this active form will go and bind to the other factors like calcium, phospholipids, and that again convert the other, and they initiate the other cascade of coagulation reaction. So this vitamin K is in the reduced form, and when it causes gamma carboxylation of this clotting factor, it converted into oxidized form. Okay, vitamin K oxidized form. And again by the vitamin K reductase enzymes, again it becomes reduced, okay, in reduced form. And again it will activate the other factors, okay, factor 2, 7, 9 and 10. So this is how this vitamin K helps in the activation of clotting factor, that is factor 2, 7, 9 and 10. That's why these four clotting factor, they are known as vitamin K dependent clotting factor. Okay, whenever there is deficiency of the vitamin K, then ultimately there is a deficiency of this vitamin K, or there is an inactivation of this clotting factor. So there may be chance of the hemorrhage. So what are the deficiency condition? Due to inadequate absorption. Okay, because vitamin K, they are available in different foods, also problems in the GIT or lack of bile salts. Okay, in that condition, there is deficiency of the loss of the K due to the chronic diarrhea. Okay, in some patient having chronic diarrhea, there is a chance of the deficiency of the vitamin K due to the repeated flushing of this vitamin K along with the stool. In use of the broad spectrum antibiotics. Okay, so some broad spectrum antibiotics like tetracycline, chloramphenicol, they cause destroy of the microbial flora. When you use for the long term, there is a destruction of the microbial flora of the intestine. So ultimately there is a decrease because of, okay, and liver diseases, because most of the that is vitamin K, they are stored in the liver. So whenever there is a liver disease, obviously the vitamin K storage is decreased. Obstructive jaundice condition also, in the jaundice also liver is affected, and malabsorption condition also. Okay, these are the different conditions where there is a deficiency of the vitamin K. What are the consequences of the deficiency manifestation? So the common manifestation is the bleeding tendency, that is bleeding from any side. Okay, like epistaxis, that is bleeding from this nose. Hematuria, that is blood in the urine. Gastrointestinal bleeding. Ecchymosis, okay, ecchymosis, that is a small bruise in the skin. Okay, and post-operative bleeding also. After operation, there is a bleeding due to the deficiency of the vitamin K or due to the deficiency of clotting factor. So what are the preparations available for vitamin K? Phytonadione, vitamin K, K1, that can be given oral, subcutaneous, intramuscular and intravenous administration. All these four preparations are available. Manadiol sodium diphosphate, it is a vitamin K3 water soluble preparation and is available for oral, IM and IV. Whereas K2, that is synthesized by our own microbial flora. Okay, so this K2 is not required to give by exogenously because it is produced inside our body. So what are the different conditions where vitamin K is required? Okay, use of the vitamin K. Bleeding due to lack of clotting factor. This I have already discussed. Factor 12, factor 2, 7, 9 and 10. Okay, these are totally the vitamin K dependent clotting factor. So whenever there is a bleeding due to the deficiency of this clotting factor, we have to give vitamin K in this condition. Dietary malabsorption, obstructive jaundice, liver cirrhosis, okay, hemorrhagic disease of the newborn, because in the newborn child there is the liver is not well developed. Okay, because of this the factor is also not formed properly, and vitamin K is also not sufficient for this condition. So there may be chance of hemorrhage in newborn child. that is known as vitamin. Okay, in that condition, or in every newborn child, that 1 mg of the vitamin K is given by intramuscular route. Okay, and after the baby is born, this vitamin K, K1 mostly, okay, because this K3 is not given in the newborn child, produce various other complication like chronic tears, jaundice, and other complications. So always we have to give K1 as soon as the baby is born, vitamin K, to prevent this hemorrhagic disease. In case of overdose of the oral anticoagulant, okay, in some condition when there is excess amount of the anticoagulants, so to prevent that, we have to give vitamin K1. Okay, it is an excessive anticoagulant. Okay, overdose of anticoagulant. So in that condition, we can give vitamin K1 by intramuscular route, because intravenous route it causes various complications. Salicylate poisoning with the hemorrhagic complication when the aspirin is given in the very high dose. Okay, in aspirin is that is an antiplatelet drugs. So due to this, there is the excessive chance of hemorrhagic condition. So to prevent that, we have to give vitamin K. So these are the very important uses of the vitamin K. Adverse effect, if you give orally, it is quite safe. But if it is given by the intravenous route, there is a flushing, sweating, dyspnea, cyanosis, collapse, and anaphylactic reaction. Okay, IM and subcutaneous route is somehow safe than intravenous route, but there is a severe pain and bleeding at the site of injection. Okay, these are the very common complication of the intramuscular and subcutaneous route, but it is somehow safe than intravenous route. Menadione, it is a K3, okay, synthetic vitamin K that cause hemolysis, hyperbilirubinemia. So always the newborn you have to use vitamin K1. Okay, no K3. So next is coagulant is fibrinogen. So this fibrinogen is obtained from the human plasma, used to control bleeding, which is associated with the hypofibrinogenemia. Okay, whenever there is a decrease in the fibrinogen content, then in that condition we can give this fibrinogen. In case of hemophilia, anti-hemophilic globulin deficiency. So these are the certain conditions where we can give fibrinogen. Infuse intravenously 0.5 gram. So next is the anti-hemophilic factor. So this anti-hemophilic factor, they are obtained or prepared from the human plasma. Okay, these are the concentrated human globulin from the human plasma. It contains the factor 8 with bone equilibrium factor. So this anti-hemophilic factor can be given in the condition where there is a deficiency of factor 8 and bone equilibrium factor. So you can use in case of hemophilia, hemorrhagic condition. The dose which can be repeated 6 to 12 hourly. Adverse drug reaction is fever with chills, headache, and skin rashes. So these anti-hemophilic factors can be given in case of Next is desmopressin. Desmopressin is a synthetic analog of vasopressin. Do you know what is vasopressin? What is vasopressin? Hello?
Antihypertensive drug.
Okay, it also uses antihypertensive drugs. Also it is also antidiuretic drugs. Okay, not antihypertensive drug. It increase the blood pressure, vasopressin. That means it constricts the blood vessels. Okay, so by constricting the blood vessels, it increases the blood pressure. So in the patient having hypertension, you should not give vasopressin. Okay, it is an antidiuretic hormone that is synthesized from the hypothalamus. So this desmopressin is a synthetic analog of this vasopressin. That vasopressin that is required for the regulation of the blood pressure, that is okay. And this desmopressin is a synthetic analog. But this desmopressin does not cause the vasoconstriction. It helps by other mechanism. Okay, it controls mild to moderate bleeding in hemophilia A and von Willebrand disease. Okay, in patients having the factor 8 deficiency and patient having von Willebrand factor deficiency, in that condition you can give this desmopressin. Infused intravenously slowly. Okay, you have to give very slowly. Next is the adenochrome monosemi-carbazone. It is the oxidation product of adrenaline. Okay, adrenaline also reduce the blood flow by causing vasoconstriction. Okay, by having by alpha action. Okay, so this is a oxidation product of adrenaline. This adenochrome monosemi-carbazone. So this drugs is used mainly to control the bleeding from the capillary. Okay, small capillary bleeding or oozing of the blood from the capillaries. So after the tooth extraction, there is a capillary oozing. Okay, in case of epistaxis, hematuria, in that condition, you can use this drug by oral or parenteral administration. Next, to have the ethamocylate. Okay, it is a hemostatic agent which can be given by oral by correcting the abnormal platelet, also increase the stability of the capillary wall. Okay, this for the prophylaxis and to control bleeding from the small blood vessels. So whenever there is a rupture of the small blood vessels, in that condition you can use this ethamocylate. It has some adverse drug reaction like skin rashes, hypotension, and headache when used by the intravenous route. I will stop here. Okay, so local hemostatic agents will continue tomorrow. Now we finished systemic coagulants that can be used by the oral or intravenous, subcutaneous, or the intramuscular route. The most important coagulants is the vitamin K. You should know details about vitamin K. Okay, what is the mechanism of action, what are the adverse drug reaction, and what are the important clinical indication of the vitamin K. What are the different vitamin K dependent clotting factors? So any doubt till here? No?
No, ma'am.